My name is Caitlin Feldman, and it's my privilege to serve as the Policy Director here with Groundwork Ohio. Groundwork Ohio is thrilled to present today's webinar, Paid Family Leave for All Ohioans, A Path to Healthier Families and Communities. I do want to make a quick announcement that Senator Teresa Gavarone had a last-minute committee conflict, and will be unable to join us as a speaker today. I would like to thank her for her advocacy on this issue and look forward to future opportunities to collaborate with State Senator Gavarone and her team. We are very fortunate to be joined today by another excellent guest speaker and recognized expert on paid leave policy, and I sincerely look forward to introducing her shortly and elevating her voice and expertise. So without further ado, I will get things started. Sarah, if you don't mind advancing to the next slide. For anyone who may be new to Groundwork Ohio, I'd like to start by telling you just a little bit about us. We are a nonpartisan public policy, research, and advocacy organization that champions high quality early learning and healthy development strategies, focusing on the prenatal period to age 5. We aim to advance quality early education and early childhood systems in Ohio by engaging, educating, and mobilizing diverse stakeholders and strategic partners to promote data-driven and evidence-based early childhood policies. And certainly that is exactly what we're here to talk about today in the context of paid leave. Next slide, please. Just a couple of housekeeping things for us. Today's webinar is being recorded. Closed captioning is available, and you can activate that on your end by clicking the button at the bottom of your Zoom screen. All participants are muted. If you have questions or comments, feel free to use the Q&A function. If we cannot get to your request or question during this event, please provide your email address and we'd be happy to follow up after today's event. And finally, all participants will receive a recording of today's webinar along with materials shared via email after today's webinar is concluded. A little overview of some of the things you can expect to hear about today in our agenda. Today's webinar will include an overview first of Groundwork Ohio's paid leave project throughout 2024. If you've been following us, you've seen some things coming out from us in the last couple of months, and I look forward to sharing a little bit more of an in-depth look into what that process has entailed throughout this year and some of our findings. This will also serve to level set our conversation today. After providing this overview for you all, I will lead a conversation with our expert guest speaker, Molly Weston Williamson, who is a senior fellow with the Center for American Progress, and I really look forward to you all getting to hear from Molly. I'll close our time today with a note about how you can engage with this movement for paid leave in Ohio and what's up next with Groundwork Ohio specifically, so that you can stay plugged in with our work as well. With generous funding from the Annie E. Casey Foundation, Groundwork Ohio has led a comprehensive exploration of paid leave policy throughout 2024 to understand the benefits, the challenges, and the opportunities that exist to make paid leave a reality for Ohioans. In reviewing our documents and throughout my portion of the presentation today, I do want to note that you'll hear me focusing my language and sort of my lens on paid family or parental leave rather than medical leave more widely. That's just because Groundwork Ohio, as an early childhood advocacy organization, has approached this issue from our lens of specialty, examining the ways that this policy interacts with young children and families in Ohio. However, this lens is not meant to dilute the importance of comprehensive paid family and medical leave policy that can also include personal medical leave and caregiving leave in addition to paid family leave. But from the perspective of Groundwork Ohio and what we've learned this year, I'll be presenting more on the benefits to young children and families. As you can see here, our work on paid family leave this year was divided into 3 primary categories, or phases rather. So in phase 1, we started just by gathering information and engaging stakeholders and sort of figuring out what is the baseline for paid leave in Ohio, where have we been and where are we now? To do that, we conducted 20 interviews with experts from diverse industries across the state, including local chambers of commerce, government agencies, business owners, direct practice professionals, and nonprofit leadership, among others. to better understand this issue and the legislative history here in Ohio. We also published an enlightening public survey in which we heard from 70 individuals about their personal experiences of paid leave. So with that survey and early on in this process, we learned from those survey responses that first of all, 50% of those that responded to the survey returned to work sooner than they wanted to because of financial strain. Also within the respondents of that survey, 25% were not compensated during their leave, and 30% had to exhaust all of their vacation balances to accommodate time off following a birth. This left them with no time off once they returned to work for things like medical appointments, illnesses, or other caregiving related needs. And finally, in that survey, seven respondents quit their jobs to give birth and care for their infant in the absence of a supportive paid leave policy. So those things alone, and certainly there were other findings as well, but those things really jumped out at us as indicating a problem and that the system as it currently stands is not working for everyday Ohioans. Taking that information that we gathered from feedback and stakeholder engagement, we advanced into phase 2 and focused on taking that information and developing a uniquely tailored education for our stakeholders and wider audiences, really to expand awareness of this topic. And so as part of this process, we published our report, The Case for Paid Family Leave in Ohio, which you can see pictured here, and in which one of my colleagues will share in the chat so that you can view it whenever you would like. It does live on the Groundwork Ohio website and is accessible at any time. We continued our focus on education both through that report, through things like today's webinar, and through the creation of our final publication titled A Year in Review, The Case for Paid Family Leave, which my colleague will also share in the chat for you. So these documents are meant to be complementary of one another, and one showcases an in-depth research report and the other is more complementary about our process and how we have processed this issue throughout the year. While focusing on expanding education in phase 2, we simultaneously continued collaboration with our external partners across the state to work with temporary work group to explore considerations and really key elements of making paid leave a reality for Ohioans. And through that work group, aim to learn together and deepen our conversations. Finally, in phase 3, with that temporary work group and in collaboration with external partners, we worked together to construct a final set of recommendations to lay a foundation and present a roadmap for future work in this area. Next slide, please. To set the stage for our conversation today, I did want to give a high-level overview of this issue and a few key things that I think are important to know. First, the United States is one of 6 countries in the world and the only wealthy country without national paid maternity leave specifically. In Ohio, 76% of workers work in jobs without access to paid family and medical leave. Many of you are probably familiar with the Family and Medical Leave Act, or the FMLA. This policy was enacted in 1993 by the Clinton administration and offers unpaid but job-protected leave for certain family and medical reasons. The FMLA, while certainly a win for American working families, it does have significant limitations and legal technicalities that prevent over 40% of the total US workforce from accessing it. Even if a working person is employed by an employer that's legally required to offer FMLA under those, again, specific qualifying circumstances, many families cannot afford to take unpaid leave. So even if the stars align and you qualify and can access FMLA, it's just an unaffordable luxury that many families are not able to participate in because it is unpaid. On the other hand, paid family and medical leave offers an important alternative that provides individuals and families with financial support during a time of transition or challenge by providing partially or fully compensated time away from work for specific and significant family caregiving needs or personal medical needs. It's also worth noting here that many employees may have access to short-term disability coverage. However, short-term disability is also not widely available nor evenly distributed. Among private sector employees, only about 1 in 10 of the lowest 10% of earners have access to short-term disability coverage. Next slide, please. This is important because while many individuals have access to paid leave in one form or another, many others do not. I mean, there's just an unequal distribution of access to these benefits. So I spoke briefly about FMLA and paid family and medical leave on the previous slide. Of course, there are other forms of paid leave such as vacation time, sick time, holidays, and you can see those depicted here. As you can see in this graphic, like short-term disability coverage, access to all these forms of paid leave are not equally distributed. The lowest earning workers are the least likely to have access to all forms of paid leave. And in contrast, the highest earning workers are the most likely to have access to all forms of paid leave. This system of rewarding higher income workers does reinforce persistent cycles of poverty for many hardworking families. Next slide, please. While federal policy in the US lags behind other countries in offering paid leave, individual state legislatures have made progress over time. So the number of states that offer paid leave seems like an ever-evolving target as this issue does continue to gain attention and traction across the US. As of fall of 2024, 13 states and Washington, D.C. had mandatory paid family and medical leave programs. Without a federal policy, each state that enacts separate state paid leave policies vary regarding the number of paid weeks of leave, eligibility requirements, wage replacement rates, and so on. So again, just without that national standard, as each individual state legislature creates these policies, they look different from state to state. That being said, of course, we know that childbirth and family care needs and personal illnesses require time away from work all over the globe, and the US is no exception. But here, a person's right to paid time off really depends on your state of residence and even your zip code. I want to zero in on Ohio a little bit more specifically. I have a list of, it's certainly a non-exhaustive list, as you can see on the right-hand side there. This is just a small example of some Ohio cities and counties that offer paid parental leave, specifically for municipal employees. Paid parental leave was also recently expanded in the last state operating budget to support state of Ohio workers. And so paid leave certainly does exist around us, but again, it remains out of reach for many hardworking Ohio families in the absence of an inclusive statewide policy. Next slide, please. So I wanted to take a moment to talk through Groundwork Ohio's policy framework and sort of how we've been thinking about paid leave this year. I shared earlier a little bit about our mission, but here is provided our vision that Ohio is the best place to be a young child and that every child has the opportunity to reach their full potential. To achieve this vision, we focus our efforts in advocating for investments at a young age that help to achieve equity and set the stage for a strong foundation for every child. On the far left, you can see our factors that build a strong foundation for young children, and these factors include early learning and childcare, healthcare access and quality, early childhood trauma prevention, and economic stability. If we can achieve strong investments in these four factor areas, we know that young children will be more healthy and more ready to learn, influencing stronger outcomes both for children while they are young and as they age. As we've been exploring the many benefits of paid leave throughout this year, it has been made very clear that paid leave is an important catalyst that can offer significant support in all four of our primary policy pillars. So I'd like to briefly talk through each of those, starting with early learning and childcare. First of all, infant care is scarcer and significantly more expensive than childcare for older children. These issues are exacerbated in historically disinvested and underserved communities. And in 2023, we have some staggering numbers from the annual center-based childcare costs that amounted to approximately $9,500 for preschool care, $11,125 for toddler care, and $12,351 for infant care. This is approximately the same as the cost of in-state tuition at a public university. It's just an astronomical expense for families, and this is the average cost of infant care. And what's more, most child care centers do not admit infants into their programs until the child is at least 6 weeks old. So paid family leave and paid leave creates an economically viable option for families to take time away from work and care for their infant, minimizing dependence on this extremely costly child care. Next, in healthcare access and quality, nationally, 25% of workers return to work within just 10 days after giving birth. So many birthing persons may not be fully healed by the time financial strain necessitates them to return to work. To make matters even more complicated, 19% of people who've given birth experience postpartum depression, and postpartum depressive symptoms may not appear until up to 14 days or more following the birth. A significant portion of the overall workforce is returning to work within 10 days of giving birth, when a large number of them may not begin to experience postpartum depressive symptoms until a few days later. Paid family leave has many benefits that interact with health and mental health, which I will invite Molly to expound upon more in more detail very soon. While I'm here, though, I do want to mention that paid leave following birth is linked to reduced rates of infant mortality. And this is largely due to expanded ability to attend to the infant's needs, fewer incidents of head trauma, and stronger participation in regular medical checkups. In our next policy pillar, trauma or early childhood trauma prevention, Ohio has some staggering early childhood trauma exposure statistics. For example, Ohio ranks 31st of all 50 states and DC for infant maltreatment. Compared to older children, Ohio's infants under age 1 are nearly 3 times as likely to be victims of maltreatment. We say that again. Ohio ranks 31st of all 50 states and DC for infant maltreatment. And compared to older children, Ohio's infants under age 1 are nearly 3 times as likely to be victims of maltreatment. We know that the health and well-being of babies and their caregivers is inextricably linked. The mental health and emotional well-being of an infant's primary caregivers is a significant factor that influences an infant's brain development. And we know from the science of early childhood development that more than 1 million neural connections are formed every second in the first few years of life, and that negative experiences can have just as much impact as positive ones as a new child is learning to navigate the world and relationships. Paid leave has been linked to reduced caregiver stress, reduced intimate partner violence, and among other significant mental health benefits, and is therefore directly linked to reduced experiences of trauma in very young children. Finally, in our economic stability pillar, 1 in 5 of Ohio's young children lives in poverty. Ohio ranks 39th among all 50 states and DC for early childhood poverty. What's more, having a baby comes at a significant cost. Even if new parents have health insurance benefits, the average out-of-pocket cost of childbirth in Ohio is just over $2,000. And this, combined with expenses such as transportation to medical appointments, infant changing supplies, clothing, other necessary supplies, all of these things combined really works together to make unpaid leave an unaffordable luxury for hardworking Ohio families. Paid leave increases family supports by meaningfully decreasing poverty. States with paid leave policies see an overall reduction in public benefits enrollment, including a 40% enrollment reduction in subsidized nutrition programs. If you're interested in learning more about anything that I've shared in these policy areas or any of our findings on paid leave, this is all included in our report, The Case for Paid Family Leave in Ohio, which my colleague shared in the chat. And I strongly encourage you to look at that document and view that research in more detail. However, for now, if I could ask you to move to the next slide, please. Now that I've given this overview of how Groundwork Ohio has been thinking about this issue, I am truly thrilled to turn this conversation over to a truly renowned expert in this space. Molly Weston Williamson is a senior fellow with the Center for American Progress and a nationally recognized expert on paid leave policy. Previously, she was the director of paid leave and future of work at A Better Balance, where she led the A Better Balance's advocacy around paid leave laws across the country and directed A Better Balance's efforts to address the needs of all workers in a changing workforce. She was appointed by Governor Ned Lamont, a Democrat of Connecticut, as the inaugural member of the board of directors of the Connecticut Paid Family and Medical Leave Insurance Authority. She has served on the board since 2019 and chairs the Outreach and Engagement Committee. She's been quoted in such publications as the New York Times, Slate, and Consumer Reports. Her academic work has appeared in the Yale Law Journal, the NYU Journal of Legislation and Public Policy, and the Connecticut Public Interest Law Journal. She clerked for the Honorable Thomas L. Ambro of the Third Circuit Court of Appeals. She graduated Pi Beta Kappa with high honors from Swarthmore College and received her JD from Yale Law School. Molly, thank you so much for being here today.
Thrilled to be here, and thank you so much to Groundwork and the whole Ohio team for having me.
Absolutely. So to kick us off, as I previewed in the context of Groundwork's policy priorities, paid leave offers numerous benefits for overall health and well-being that extends beyond financial support. So from your perspective, could you highlight some of the most significant benefits in your view, particularly for infants, new parents, and families?
Sure. So when we look sort of across the board at all of the reasons that people need paid leave, what we know is that when people don't have the paid leave they need, they are more likely to put off the healthcare they need or to just go without, to forego the healthcare they need. And what study after study shows us is that when you delay or forego healthcare you need, that has detrimental and sometimes pretty devastating health impacts. It's bad for your health to put off or go without the healthcare you need. So to give one example, among cancer patients, a 4-week delay in needed surgery increases the risk of death by 6 to 8%. And if you delay longer, the risks get greater. And so what we know is that paid leave means a greater ability to get the healthcare you need when you need it. And that means better health for all of us. And as you so kindly foreshadowed for us, we have a particularly robust body of literature on the health impacts of paid leave when a new child joined the family. So for new moms, as you highlighted, paid leave means greater physical well-being. It means a dramatically lower likelihood of being rehospitalized in the year following birth. It also has really pronounced mental health impacts. So we have really strong results in terms of lowering the risks of postpartum depression. And what's more is the effects are cumulative. So more weeks of paid leave means lower rates of postpartum depression. And when we think about sort of the mechanics of that, as you highlighted, 22% of new moms return to work within 10 days of giving birth, but another roughly a quarter return between 10 and 40 days. So what that means is almost half of people who give birth are returning within 40 days. Whereas the standard of postpartum care in the US is you don't have your first and typically only visit with a doctor following giving birth until 6 weeks. So what that means is nearly half of all people who give birth are back at work before they have seen a doctor at all. And I think that really goes to show you what we're losing, what we're missing when folks are dealing with the pretty significant medical impacts of giving birth without the time they need. And for babies, those impacts are just as pronounced. So we know that paid leave means lower hospital admissions for babies. It means babies are more likely to get their well baby visits, to get their vaccinations on time. We know that paid leave means more secure attachment, and that has lifelong impacts on child health and child development. You highlighted some of the research on pediatric abusive head trauma, which is one of the key mechanisms of positive health impacts. But another piece to highlight is thinking about paid leave in preventing the spread of infectious diseases in really, really young infants. So to highlight just one study, when New York's paid family leave program kicked in 2018, newborn hospitalizations for RSV, which is a really serious respiratory illness, went down by 30%. And that is likely because when really, really young infants are able to stay home, when their parents are able to watch them and care for them, that reduces their risk of getting sick. And particularly when we're talking about the youngest of infants, RSV is potentially fatal in newborns. And so what we know is from all of these impacts, from reduction in infectious disease, from reduction in various kinds of maltreatment, from greater ability to just get regular pediatric care, which makes it easier to find out early if there is a problem. Both American and international studies show that paid leave reduces infant mortality. And again, more paid leave reduces infant mortality, where you can graph out how more weeks corresponds to lower rates. And so I think what all of that shows us is that paid leave means greater health. It means greater health for cancer patients. It means greater health for new moms. It means greater health for babies. And so what all of that adds up to is that paid leave doesn't just save livelihoods, it saves lives.
Thank you, Molly. Paid leave can help close gender wage gaps by reducing career disruptions, but it also has potential to narrow long-term wealth gaps. How can a well-designed policy address both immediate wage equity and systemic wealth disparities over time?
Sure. So I think often it's intuitive for folks how access to paid leave helps people's pocketbooks while they're on leave, that having some money coming in rather than no money is better for your bank account and for your ability to pay your bills. But the piece that I think is not always as intuitive is to really think about how that benefits family economic security throughout your life. Because when you are able to take the paid leave that you need when you need it and then come back, what that means is you're less likely to be pushed out of the workforce, you're more likely to stay in the same employer where you can advance and get promoted, and you're going to earn more over the course of your career. And that is better for your family's economic security, but it's also better for the wage gap because we know that disproportionately women are punished economically for taking time out of the workforce to care for a new child. They're still disproportionately shouldering the responsibilities of caregiving for seriously ill and older adults. And so when we provide this tool to better help people balance work and care, that's really an investment in women's earnings over the course of their lifespan in ways that are helping to address some of the root causes of the gender wage gaps. And when we think about wealth disparities, I think a well-designed paid leave program can really help us mitigate a lot of those ongoing racial wealth gaps we see. I think just big picture, um, if you have greater access to wealth, it's a lot easier for you to take leave that is either unpaid or only partially paid than someone who is really relying on every paycheck just to pay their bills. And we know that there is a significant race wealth gap in this country that determines who does and does not have access to those opportunities. But we also see that in the ways that lack of access to paid leave plays out differently for different people. So we know that Black, Latina, and Native women are disproportionately likely not to be able to take a needed leave. So it's not that they're taking the time and then it's unpaid, that they cannot, their families cannot sustain them taking that time. And I think that plays out particularly for Black women, especially Black mothers, because the vast majority of Black mothers are sole or co-breadwinners for their families. And so what that means is that Black women are especially likely to be forced by economic necessity to keep working rather than taking needed leave, including leave for their own serious health needs. And then when they must take leave, if they have to take leave unpaid, that hits their families especially hard. And so I think what we're really thinking about here is when we are starting from a place of significant race and gender wage gaps, when we are starting from a place of significant racial wealth gaps, smart, thoughtfully designed, equitable policy is really helping us get at some of those causes while also in a universal policy providing particularized benefits for the folks who are most likely to be left out and who are most harmed by our current economic systems.
Thank you, Molly. Appreciate your perspectives there. I'd like to pivot a little bit to addressing some misconceptions about costs of paid leave policy. So many public sector businesses may be concerned about the cost of paid leave, but research also indicates that paid leave can lead to increased employee retention and productivity. So what is important for business owners and business leaders to know about paid leave and its benefits to their workforce?
So the first thing just to remember is paid leave is good for business. We know from study after study that paid leave is a really powerful recruiting tool, especially in a really competitive hiring market. So most employers report that paid leave increases their ability to recruit talent. And we see that play out in a lot of ways. So for example, workers who have access to paid leave are 22 percentage points more likely to recommend their job to a friend. So it's helping get good folks in the door. But what's more is paid leave doesn't just help businesses bring in new employees, it helps them keep them. So paid leave is a proven tool for improving employee retention, for helping you keep the employees you've already invested in. And that goes directly to the bottom line because employee turnover is really, really expensive for employers. It is expensive to recruit people, it's expensive to train people. And what's more, in a way that I think is kind of common sense, a brand new person starting in this job is never going to be as productive as the person who has been doing this job for a long time, who knows your company, who knows how to do the work. And so for employers, helping you get really great people and then keep them, that's really strong bottom line benefits. And it's not surprising then that research also shows us that paid leave means higher productivity and then greater profitability. So again, we've got to bust this myth that paid leave is somehow harmful to business because it's really exactly the opposite. And so when we think about costs, one, businesses that don't have paid leave are paying the costs right now of not having those advantages. And really, I think that goes to how are we structuring paid leave? So you mentioned that there are 13 states and DC that have already passed state paid leave laws. And so the way that those laws work are insurance systems. So what that means is that employers and employees each pay in a little tiny fraction of each paycheck. So typically we're talking well under 1%, so less than a fraction of 1 penny on the dollar, into this insurance system. And then when a need for leave arises, so there's a new child, there's a serious illness, it's that insurance system that's paying out the benefits, not the employer. And that's similar to the way that something like Social Security works. That's how unemployment insurance works. So when we say states have these laws guaranteeing paid leave, we're not saying laws that say, hey, employers, you just have to pay out of pocket for weeks and weeks of leave. What we're saying is pay this little tiny amount into the insurance system. And then when your employees need leave, that insurance system is taking care of them. And you, as the employer for businesses of all sizes, get to reap those rewards. And that's what the studies about state paid leave programs show us. They show us reduced turnover and better retention. They show us improved employee morale and well-being, which again has bottom line benefits. We see greater productivity, we see greater profitability. And so when we're talking about costs, you've also got to talk about benefits. And what we've seen from paid leave in these state programs in individual businesses is that paid leave has really good return on investment. And so when we're thinking about costs, I think the way that we really need to think about it is Ohio's businesses, the economy really can't afford not to guarantee paid leave.
Thank you for that, Molly. And I don't mean to steal your thunder, but I also think that one of the most compelling arguments for paid leave is that people need paid leave, whether it's paid or unpaid. That, the question is, how are you supporting your workforce? How are you supporting your employees? And I think that your answer there really gave a well-rounded perspective on that. Thank you. If I can also zero in a little bit more on small businesses too, I think small businesses are sometimes seen as the most vulnerable to the financial implications of offering paid leave. So what is important to consider when designing a paid leave policy that works specifically for small businesses?
So when we think about small businesses, the thing we have to know is that big businesses get that business logic we just talked about. They understand that return on investment. But right now, what we have in Ohio is a pay to play paid leave system. So larger, wealthier employers can afford to provide generous paid leave benefits out of pocket, and they get a big leg up. They get another advantage they don't need in recruiting and retaining the employees who are going to make their business thrive in productivity, in profitability, while small businesses and newer businesses that can't afford to do that out of pocket lose out. And that's bad for small business, that's bad for entrepreneurship, that's bad for the health of our economy. And so when we think about stepping up to provide a public program, what we're really talking about is giving Ohio small businesses a level playing field. We're giving them a shot at reaping all those rewards we talked about at a price they can afford instead of having to pay for the full program out of pocket, which is just not realistic for most small businesses. And what's more is that public paid leave programs really give small businesses a triple benefit. So they get that level playing field, they get all of those recruiting, retention, productivity benefits we talked about, but then they also get this additional tool because the benefit of providing paid leave through an insurance system is that as an employer, while your employee is taking leave, the insurance system is taking care of your employee. So you as an employer still have in your bank account the money that you were going to use to pay that employee's wages if they hadn't taken leave. And you get to use that tool however you need to support your business. So if you need to pay overtime or pay extra hours, if you need to hire temp workers to cover the leave, you have that resource to use however is right for your business to cover that absence. And what's more is that what research shows is actually most employers don't actually hire additional employees or even necessarily take on additional hours. The most common approach to covering a leave is just to reassign work or to put off projects. And so if you're covering that leave in a zero cost way, that resource of the wages you were going to pay, you get to reinvest that in your business, you get to save that for a rainy day. Again, you get to use that in a way that's right for your business. And then last, I think particularly for small business, this piece is really important but often overlooked, is that the public program is really taking the administrative weight of handling paid leave off of employers. The public program is the one that is handling the logistics of reviewing medical documentation, of tracking how many weeks folks are out, of making sure that folks are actually getting their checks cut. And so that's especially important for small businesses who are less likely to have a dedicated HR person. They're less likely to have the capacity to do that. The government is really sort of, in some ways, like your free third-party administrator handling that work for you. And so it's not a surprise that when we look across all of these different benefits, that when you survey business owners and when you survey small business owners in states that already have paid leave programs, they support the programs. And in fact, what we saw in some pandemic era research is that when small businesses have employees who actually took paid leave, it makes them support the program more. So more exposure to it actually increases the impact. And a final piece that I think we don't always think about is we often talk about small business and paid leave in terms of employee impacts. And we miss the fact that small business owners are human beings who also need paid leave. Small business owners get breast cancer and need treatment. They have new babies they want to stay home with. They have parents who have strokes and they want to care for. But if you don't have access to this kind of public program, most small business owners cannot afford to take time away from work because if they don't work, they don't get paid and their business does not succeed. And that means truly impossible choices in ways that are bad for small business owners' health. They're bad for the sustainability of entrepreneurship and small business success in ways that have really big equity implications. And that goes triple for small business owners who have no employees. And so when we talk about small businesses, the vast majority of small businesses in this country have zero employees. They are one woman, one man shops. And when you are self-employed, if you don't work, you don't get paid. Like, end of story. And that is just not realistic. And so what that means is we have small business owners who are not getting surgery they need, who are returning to work within days of giving birth. And so when we really think about what paid leave could mean, we are really creating opportunities to invest in access to entrepreneurship, to invest in thriving small businesses. And so we've got to bust this myth about paid leave and small business. And I think really what we need to understand is that guaranteeing paid leave isn't something we're doing to small business, it's something we're doing for small businesses. It's an investment in small business vitality and competitiveness. It's an investment in access to entrepreneurship, and it's an investment in a fairer, more sustainable, more competitive economy.
Thank you for that. Such an important distinction. I appreciate your thoughts. Turning more toward ensuring greater equity and access to paid leave policy, current paid leave policies are most often available to higher earning white workers, and yet it has immense potential to advance economic stability for marginalized communities and help close racial poverty gaps. In designing paid leave policies, what specific elements or safeguards should be included or considered to ensure that the families who stand to benefit the most can equitably access those benefits?
So I'm going to talk about 5 program elephants. So first, coverage. We got to cover all workers. We've got to cover part-time workers, full-time workers, no matter what industry you're in, no matter the size of the employer. And when we think about equity, we know that when the rules are too restrictive, it's low-income workers who are the most likely to lose out. Because they're the folks who are losing out right now. And I think when we think about how do we structure these coverage rules, we should be thinking about the fact that right now, white collar professional workers are much more likely to have access to paid leave, whereas folks in industries like food service, retail, seasonal and agricultural workers are much more likely to be left out. And so we should be looking at policy solutions that are universal and specifically making sure that we're including the folks who are most likely to get left out in the status quo. The second piece is eligibility. So typically the way that state paid leave programs are set up is that employees need to have earned some minimum amount of money or have worked for some minimum amount of time to qualify. It's similar to the way that unemployment insurance works. And so the goal here should be to make sure that those standards are achievable for all workers, for low income workers, for seasonal workers, not setting some bar that folks are never going to meet. But a bigger piece about that is making sure those standards are portable so that workers can take their eligibility with them for the benefits that they have earned and I can't emphasize enough paid for as they change jobs, if they get laid off. So you're not having to start over again if you have to change jobs. And that's important for everybody, especially in a changing economy where if few of us are staying in one job for years and years, but it's extra important for low-income workers because low-income workers statistically change jobs more frequently than other workers. The third one, and I hope this one is obvious, but it has to be enough money. So when the wage replacement rate, which is the percentage of your own income that workers receive while on leave, is too low, low-income workers and often middle-income workers can't afford to take leave. So for example, in California, when they first passed paid family leave, it wasn't enough money. And so they had to go back to their legislature and raise the wage replacement rate because what they found is that a lot of low and middle income workers couldn't afford to take this leave. And that is important for ability to access paid leave. But again, if we're thinking sort of structural equity, in a program that workers are paying into, again, that insurance system model, if your wage replacement rate is too low, low income workers are paying into a program they will never use. And so what that means is that lower income workers are paying for benefits for higher and middle income workers, and that's not right. And so we have to make sure that all of these elements are really making it accessible for low income workers. And I think wage replacement is really key to that. The fourth piece is job protection. So we don't just need laws that let you leave, we need laws that let you come back. Because if your job's not there when you come back, it's not really paid leave, it's severance pay. So what research has shown is that right now, the number one reason people don't take a leave they need if they can't afford to take it unpaid, but the number two reason is fear of losing their job. And that is very much a reality for workers across this country, particularly low-income workers, who, to your point earlier, are disproportionately likely to be left out of Family Medical Leave Act. And so state paid leave laws need to proactively guarantee the right to get your job back to all workers. And then last but not least, outreach and education. If you design the best paid leave program in the world, but workers don't know it exists, it won't benefit them, it won't improve equity. And so we need dedicated resources. That takes time and money, that takes supporting trusted messengers in the community to make sure folks know about these rights and really thinking strategically about how to make sure that that information is getting to the folks who are most likely to be left out. So folks who might wrongly assume they're not covered. So think part-time workers, think agricultural workers, folks who may be less likely to get this information through their employers, so domestic workers or folks in rural areas, or folks who may face other barriers to access. So for example, is your outreach and education in multiple languages to make sure folks are accessing information in their preferred language? So when we think holistically about how do we cover everybody, how do we have workable eligibility standards, make sure it's enough money, make sure it protects your job, and make sure folks know about it, Ohio has the opportunity to really build on the lessons learned from other states to design a program that's going to work for everyone and that's going to consciously remedy these gaps we're aware of.
Beautifully said, Molly. Thank you for that. And I think you did a great job of summarizing, the importance of education campaigns in this issue. But I'll ask this next question in another way and see if it galvanizes additional thoughts. I'm curious if you could speak to the role that public education plays in building support for paid leave policies more widely, and how advocates in Ohio can effectively convey the importance of these policies to diverse audiences.
Sure. So one thing we know is that paid leave is overwhelmingly popular. It is supported by strong majorities of Americans of every political affiliation. It is supported by majority of small business owners over and over again. Survey after survey, paid leave polls through the roof. And we know that 2/3 of Americans live in states without paid leave laws. And so I think when both of those things are true at the same time, we know we've still got work to do. And so advocates have really essential work to do in helping to share what the research shows. So all of the stuff we've been talking about today, so helping spread the word about the powerful impacts of paid leave on working families, on health, on small businesses, on the economy. I think doing some of that myth busting, addressing those misconceptions and frankly some outright falsehoods that are perpetuated by opponents of paid leave. So really spreading what we know, making sure that the data is out there, the evidence is out there. But I think alongside that sort of research-based piece, there's also a really huge role for storytellers. Because facts and figures are great and we've got them. We can give you dissertation after dissertation of the proof for paid leave. But often what's really most compelling is individual people standing up and talking about what paid leave means to them, what it cost them when they didn't have it, what they would gain if they did, what it meant when they did. That's often the piece that is really the most powerful. And that takes courage, that takes time and resources. But I think that we really can't overlook the power of that storyteller piece. And I think big picture, the thing about paid leave is there's something in it for everyone. There are so many arguments in favor of paid leave that effective advocacy often means figuring out which of the many, many benefits of paid leave or which of the many, many costs of inactions to highlight for a particular audience based on what they care about. Because that's really what effective advocacy is about. You don't convince people to do something based on what you care about, you convince them based on what they care about. And one piece that we haven't talked about yet, but I think is worth really thinking about, particularly as we think about different kinds of audiences, is talking about the importance of paid leave for veterans and military families. And that's something that I care a lot about and that I think is really worth thinking about because we know that targeted paid leave helps military spouses and partners address the really disruptive impacts of deployment. We know that paid leave helps veterans to get the health care they need, the physical and mental health care they need for service connected health needs. It helps military caregivers provide this care. And we know that supporting veterans and military families is the right thing to do. It's the right way to take care of people. It's true to Ohio values. But it's also a national security issue because the way that we treat veterans and military families is directly connected to the ability of our all volunteer military to continue recruiting and retaining troops. So I think really thinking about all of these different pieces of the puzzle and really thinking strategically about which are the pieces that are most relevant for a particular audience, including groups like Groundwork highlighting the early childhood case. I know you've got great partners in Ohio that are highlighting other pieces of this puzzle.
Thank you, Molly. Such an important point about the case for veterans. I appreciate you raising that. And I would love to pose just one final question with a small tack on because I think we have a great question in the Q&A that I'd love to hear your thoughts. So my question to you is the paid leave advocacy can take years and it often faces many roadblocks. So I'd love for you to leave us with maybe a word of advice for how advocates in Ohio can continue working on this issue and make progress. And in our Q&A, we have a question from someone who's asking, if you work for an organization that doesn't offer paid leave, how can you go about convincing leadership to support this project? So if you could tie that in, would love to hear your thoughts.
Sure. So I'll give two pieces of advice overall, and then we'll talk about individual employers. The first one is just stick with it. So every state's campaign looks different. They take in different periods of time. The fight for paid leave in this country has been going on for literally 100 years. But what all of these states have in common in states that pass paid leave is that the advocates and the champions kept going. So I can't promise you a lot about any state acting, but I can promise you you're going to run into obstacles and challenges. And so sticking with it is really essential. The second piece is, I think, to motivate you to stick with it is to really stay focused on what the win would be. And I don't mean that just abstractly, though the abstract amount. Like, I don't mean that just in terms of billions more dollars into Ohio's economy, which will generate more jobs. I don't mean that just in terms of small business success or labor force participation, because those numbers matter. But the real win is when folks in Ohio get to go get the treatment that can save their life. They get to soak in that smell from a newborn baby that just makes you want to snuggle them all day long. They get to be there to hold their parent's hand in the last moment. And so when we talk about fighting for paid leave, that's what you're fighting for. You are fighting for those moments that you don't get, just as much as you are fighting for a stronger, fairer economy, just as much as you are fighting for equity and equality. And so I think really keeping eyes on the prize is what helps you keep getting through the day. And so to the person in the chat who was asking about how do you get your employer on board, um, the first part is I think just making the business case. Like the ROI is there. There are groups that do really great work specifically on advocating. So, for example, Center on Parental Leave Leadership has done some really great work in this space. Moms First has done some great work in this space. There's lots of good resources out there to help make the case to individual employers about this piece. I also think this is a place where, depending on the size of your employer, I think lots of employers find it really compelling when you make the case in terms of them. I think really understanding for small business owners, for folks who are in small, including frankly a lot of smaller nonprofits, is to not just think about here's what it would mean to your employees, but what would it mean to your family? What would it mean if you were able to take the time, if you knew you would be able to take that time? And so really, I think thinking about the ways in which right now in the status quo, all of us are paying the price for failure to invest in paid leave. We are all paying the price in our economy. We are all paying the price in small business competitiveness. We're all paying the price in our health and in the impacts on our family. And so what we're really fighting for and working towards is instead of paying that price economically while paying that price in our real lives, let's start investing in solutions that work for Ohio workers and families, that work for Ohio businesses, that work for the economy, and set us all on a path to the future that we want to see.
Thank you, Molly. Amazing. Thank you so much for your time and your insights and for sharing that with us today. It's really an honor to be joined by you and to have your support in this growing movement in our state. Thank you.
Thrilled to be here, and thank you for all of the work that you do.
Absolutely. If I could request my colleague to share screen again, I have just a couple more slides and some information about how you can get involved with this movement that continues to grow in Ohio. We have here a few accomplishments that Groundwork has achieved over the course of the year. Of course, 1 year is such a short period of time to make systemic change, and yet we have seen true growth in this space. And we have certainly enhanced our portfolio of work by getting more ingrained and building awareness around this issue. I encourage you to look at our final report, both the case for paid family leave, but also the year in review that details some of these accomplishments more. What I would really love to focus on, and I saw a couple of questions in the Q&A, thank you for sharing those questions. Collaborate Cleveland is leading an ongoing statewide coalition focused on paid leave advancement in Ohio. I've been thrilled to attend a couple of these meetings that they've had. This is a new coalition that is growing in momentum and growing in popularity. I would love to share Abby Westbrook's information here with you. She was not able to join us today as she's traveling, but she asked that I please share information about this growing coalition and invite all of you to reach out to her if you have an interest in getting more involved with this movement that, again, is still growing and continues to grow. I've also provided a QR code here that I encourage you to pull out your phone and take a picture of it if you haven't already. That will take you to Collaborate Cleveland's website and their landing page that's specifically dedicated to paid family leave. So you can see how they're framing this issue, the things that they're working on and focusing on. And certainly we invite you to consider joining the coalition and joining the movement. If you would advance to the next slide, please. As far as staying in the know with what's going on at Groundwork Ohio, would love to invite you to consider joining Groundwork Ohio's weekly morning meeting. This takes place every Thursday from 9:30 to 10 a.m., where we feature different speakers from around the state to talk about programs and policies that are aiming to make Ohio a better place for young children and families. These brief weekly meetings are an opportunity to deepen relationships with one another, hear real-time updates, especially as we're going through the upcoming state budget season, and build the power of Ohio's early childhood movement. To learn more and register, you can visit groundworkohio.org/events. And finally, we have Groundwork Ohio's Advocacy Day. We invite you to save the date, March 12th, 2025. This is an all-day in-person event at the State House. Would love to see you there if you're able to make it. Again, Wednesday, March 12th, 2025 for Groundwork Ohio's Advocacy Day at the State House here in Columbus. I also invite you to follow us on social media to stay apprised of routine updates and future events that we put on. And I want to thank you all the advocates, partners, and policymakers on this webinar today, and want to extend another huge thank you to Molly Weston Williamson with the Center for American Progress for the true gift of your time, talent, and expertise today. This concludes our webinar. For more information about Groundwork Ohio, please visit our website, www.groundworkohio.org, and be sure to follow us on those social media platforms. Thank you again for joining us and have a wonderful day. Thank you.